How many times do people clean their teeth?
Because I'm a busy person, like 2 times a day, exeni, I brush and then at night. But during the day, I make sure in just to rinse them out.
I do brush my teeth 2 times in a day, in the morning and then after, late, like at night.
Every time when I eat, I go rinse my mouth. But then when it comes to brushing, I brush twice in a day.
I brush my teeth in the morning and in the evening, and I sometimes floss them.
So oral health is an essential part of your overall health and well-being. Now, poor oral hygiene can lead to dental cavities and gum disease, 2 of the world's most common health problems. Now, gum disease ranks second only to common cold in terms of prevalence, with an estimated 90% of South Africans experiencing the problem at some point. Now, it's really in your best interest to practice good oral hygiene. Not only does it ensure a beautiful smile, but it's also good for your health. September is National Oral Health Month, and so today we discuss oral health. And our guests today are the Acting Director of Oral Health from the National Department of Health, Dean of the School of Oral Health Sciences from Wits University, and an oral hygienist. Now, we invite you to be part of the show by asking the panel some questions or simply just sharing your views with us. The number to call in that case is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show ahead, coming to you just after a short break. I'm Dr. Sello Mutaung, and this is Health Talk.
Life can throw all sorts of surprises at you, often when you least expect it.
Sorry, Mom.
That's why it's important to have medical cover. Me? I didn't want just any medical scheme. I wanted a scheme that I could rely on, that I could talk to at any time, that I could afford. I didn't just get medical aid. I got medical paid.
The story of Guatyu is a microcosm of the problems that continue to plague land reform, where the challenges of redistribution, restitution and security of tenure include not only addressing past injustices and making farms productive, but reclaiming identity.
I had, this belief that this is our government. Definitely, they will do whatever they can do for us to change our lives. But unfortunately, I think I was just naive.
It is the government of South Africa that is owning this land, and it is that government that is denying these people.
SABC is independent and impartial, and it's important that as we deliver the news, we do so without fear, without favour, without prejudice, and that we ensure that we get the multiplicity of views so that our stories and coverage is balanced.
We pride ourselves on being impartial as well as independent. On the agenda, we basically break down the stories of the day, give it more substance and give it more detail. So all in all, we basically take the news agenda of the day forward.
But more than that, we'll be able to reflect the stories of ordinary folk, people who are trying to make ends meet, facing the most incredibly difficult obstacles and circumstances, and that they will find that their realities are expressed on the SABC.
To be a part of something like this makes me proud, and I think that to be able to report the news in a fair, just, independent and impartial way is what the public broadcaster stands for.
What are the dental problems seen at the Hillbrow Clinic daily?
There are 2 main ones. First, it's what we call caries, that when in the normal lay language is rotten tooth. And the second one is the gum disease, where the attachment between the attachment and the gum of the tooth is affected and the tooth ends up being loose. Okay, and then there's also different types of other diseases that affect the gums.
What are the common causes of these dental conditions?
First, caries, which is a rotten tooth. It's it's because number one, we don't brush our teeth properly. Then number two, we don't visit our dental clinics or our dentist regularly as recommended.
Is there a difference between the children and the adults' dental conditions?
Yes, there is a difference, but not that big of a difference. Mainly the children will get what we call rampant caries. You see the front 4 teeth that are very rotten. Sometimes you would think the child doesn't have the teeth only when they smile. You see that it's small pieces and bits of roots.
What kinds of treatment does the public clinic offers?
In this clinic we offer what we call restorations. Normally patients call fillings, where the patient come in with the rotten teeth. We clean out all the rotten stuff, then we fill in with either amalgam or composite, whatever material that we have in the clinic. Those are the fillings. We offer fillings, and then we also offer dentures. Those are false teeth. Then we also offer scaling and polishing, which is normally known as cleaning, where you try and clean in between the tooth and the gum so that they don't develop what we normally gum disease. And cleaning is also targeted at removing the what we call tartar. We remove that tartar because the tartar is the one that damages the attachment.
All right, so let's tackle the subject of oral health with my special guest. First up, it's a great pleasure to welcome Professor Simon Nemutandani, who's Dean of the School of Oral Health Sciences at Wits University. Welcome to Health Talk, Prof.
Thank you.
All right. And next to the Prof, we have Amanda Smith. Amanda is an oral hygienist in private practice. Am I correct?
I'm working in the public service.
Oh, in the public service. Welcome to Health Talk.
Thank you.
All right. And last but not least is Dr. Mzimkhulu Mcuba, who's the Acting Director for Oral Health at the National Department of Health. Welcome to Health Talk, Dr. All right. Okay, perhaps let's start with you, Prof. We're talking oral health. Let's talk the basics here. What is oral health? And, what do we have? What is this oral cavity? Is it the mouth?
Yeah, oral health, let's just start by saying oral health is the gateway to general health.
Right.
Whatever you talk about general health, it starts from the mouth.
Right.
As we are communicating now, we are using the mouth.
Right.
When we smile, when we show emotions, we are using the mouth.
Mm-hmm.
Even when we are swallowing, chewing, and all the structures around the mouth,
right,
we are talking about those things.
Mm-hmm.
Now, if we are talking about oral health, we are saying, let us be talking about free from dental caries. You have seen the insert there.
Right.
Spoke about dental caries.
We're going to come back to what's common around there. So you're saying health is really absence of disease.
It's absence of diseases, which is dental caries and all those diseases that we have. Yes.
Right. Now, Amanda, I'm sure you come across all of these cases in your daily practice. How common are these? In my introduction, I said, 90%, almost 90% of South Africans will have some form of oral or ill health or gum disease at some point in their lives. How true is that?
It is very true. It's very common.
Right.
If you look at our 5 to 6 year olds and even our 11 to 15 year olds, it's about the 60% prevalence of caries in those groups of children.
So is it more in children more than in adults, or is it about the same?
I don't know about the adults. I don't have statistics on that.
Right.
Because I'm working in the public sector, I'm more dealing with children.
Right. You wanted to comment?
Yeah. You see, caries would start from the early ages as you are developing, and that rotten tooth, as we call it in the normal language, or the gum disease, bleedings, and all those things, you would continue with it if it's caries, unless it's treated. But in terms of prevalence, we had a study here in South Africa which shows roughly 60% of the children between 4 and 6 years have that one. But among adults, if you just walk around the streets, there are many of our patients that are walking around the street with rotten teeth.
Yeah.
Some of them have filled. Some have missing teeth because they have been extracted for one reason or another. So the prevalence in South Africa, will say, it's roughly around 70%. And if we talk about most common oral diseases, we are talking about dental caries and gums, which affect nearly 90% of the total population that we have.
We're going to come back to learn about what else can go wrong in the mouth. But let's get a perspective from the National Department of Health. I mean, clearly, oral health is your focus area.
Yes.
Any particular area of concern?
First of all, the dental caries, especially in children, in a study that was done in 2000, as Prof is saying, about 60% of untreated caries, that is, they were not removed, they were not fixed, but they were in children. And the reason being, if you look at children's teeth, we call them milk teeth, they are going to exfoliate or they are going to come out. You find that most parents, they don't look after these teeth because they say, no, down the line they'll be out and then we'll have the adult teeth. So that's why you find them in children, they are high. If you look at the District Health Information System, you'll find that even in adults, we've got more extractions. That means we're taking out more teeth. And what we picked up, people, they come to the facility or to the professional when there's pain already. So when there's pain already, most of the time, they want to take it out. It cannot be saved. But as Dr. has said in the beginning, yes, they can be saved by removing the rot and then fill it up. But most of the time, the people come late. So that's where now nationally comes in with the preventative programs.
Yeah, we're gonna come back to the preventative programs. Before that, perhaps let's just understand. We've spoken about dental caries. We've spoken about gum disease or gingivitis or whatever it is. What else is there that can go wrong in the mouth?
Well, let's start from the beginning. When a mother is having a child, and there is some problems, we could call it genetical or developmental stage, where you have the two plate or on the palate, the two bones don't come together. You've got a cleft palate. These kids are born without the upper part of the mouth being closed. And that is the developmental or the congenital problem, which is very common. The other problem that may arise is when we have maybe habit of smoking. And this one will lead to oral cancers. We know there is a lot of oral cancers. The other problems that could arise out of it is normal when people say, hey, look, my mouth is smelling.
Right.
Bad breath.
Okay.
And it affects a lot of things. But this is around the gum disease, dental caries, and other conditions. Okay.
It's interesting you mentioned bad breath, because some people say it can either be from the mouth or a little deeper.
Yeah. Bad breath, you have to first check it whether it's not coming from the teeth that are rotten.
Yeah.
And the other one could come from the gums, around the gums of the gingiva, you see they're bleeding.
Yeah.
The other one could come from digestion, from the digestive system. Then the breath comes out. You know, if you have eaten an onion, you will smell it. But usually the bad breath could be coming from the metabolic system that has not gone well for us.
Okay. Let's just stay a little bit on the signs and symptoms. I mean, Dr. Mguba mentioned pain. I suppose the main one is pain. We've just mentioned bad breath. Any other signs and symptoms of oral health or problems?
Yeah, we could have bleeding gums.
Right.
This is when people are waking up in the morning, they just find, oops, the pillow is having blood, or when they're brushing or when they're spitting, blood comes. It tells us there is problem around the gums. The other problem which usually affects the children is when they are having abscess, the swollen. You could see people are walking around with the area that is swollen. That is because of the abscess, the rotten tooth that has now gone down to the root of the teeth, and then you find they have that swollen area. Those are the most common things that we find.
Okay. Dr. Mduba, why should we worry and focus on oral health? What can go wrong if people go with these diseases untreated?
The challenge with oral health diseases, by and large, they do not kill.
Yeah.
And mostly health is about life, continued existence. And then you'll find people, or generally, even in the public sector, if it does not kill, you reduce the budget. But for me, oral health is about quality of life. First of all, I would say functioning. As Prof said, we chew our food. That's where you start. If you do not have teeth, you change your diet. And then especially for children, it affects their weight, nutritional status, because now the type of diet they have to eat is a soft diet, does not have a roughage. So it becomes a problem with the weight, under overweight or overweight because of the type of diet. Secondly, for me, quality of life is appearance. We call it psychological self-esteem.
Yeah.
If you do not have your teeth, you go to an interview, especially if you are young adult, going to an interview or coming here for whatever, acting in Mubang or whatever, if you do not have a teeth, it affects your self-esteem.
Yeah. And when we spoke about that beautiful smile, perhaps it's just a good point to just go on a quick break.
Okay.
When we come back, we continue our discussion on oral health. Please stay with us.
SABC is independent and impartial, and it's important that as we deliver the news, we do so without fear, without favour, without prejudice, and that we ensure that we get the multiplicity of views so that our stories and coverage is balanced.
We pride ourselves on being impartial as well as independent. On the agenda, we basically break down the stories of the day, give it more substance and give it more detail. So all in all, we basically take the news agenda of the day forward.
But more than that, we'll be able to reflect the stories of ordinary folk, people who are trying to make ends meet, facing the most incredibly difficult obstacles and circumstances, and that they will find that their realities are expressed on the SABC.
To be a part of something like this makes me proud, and I think that to be able to report the news in a fair, just, independent and impartial way is what the public broadcaster stands for.
Township under siege, roads blockaded, and the atmosphere here remains tense. Residents want their houses damaged by the storms repaired.
Rains are coming. Who's going to repair my furniture?
Police remain vigilant.
We may never have sufficient members, but the members that we have, we are comfortable with them. We are in a position to deal with the situation.
From us also as councillors, we lack information as it's not cascaded to us.
Welcome back. We're talking oral health with our guest, Professor Simon Namatandani, Dean of School of Oral Health Sciences from Wits University, and then, of course, Amanda Smith, oral hygienist, and Dr. Mzimkhulu Mcuba, Acting Director for Oral Health at the National Department of Health. Gentlemen and lady, we were talking earlier about obviously understanding what oral health is and all the problems related to that. Before we come to causes and risk factors, is there any link between oral disease and other diseases that people can get? Prof?
Yeah. Earlier I mentioned about caries.
Yeah.
If the tooth is not treated and it goes down into the blood system, you've got abscess. But there is an association between heart problems and dental caries.
Right.
The other problem is if you cannot chew the food properly in the mouth. The digestive system starts from the mouth. You will remember when a child starts to be 6 months. They are weaned from breastfeeding. Then the teeth start to come into the mouth. Those teeth are preparing the child for digestive system as they are moving into hard food. So if you are not able to chew the food properly, that means there will be more acid released when the food reaches the stomach. And when acid is released more than what is necessary, we then have problems. I've got peptic ulcer and other ulcers. The other problem is the cause for dental caries. It's usually sugar.
Wow.
Now, sugar, we know that it's linked with diabetes and also the high blood pressure. So even the smoking problem, it's linked. So when we say oral health is the gateway to the all health, is that it starts in the mouth. What you eat also determines your general health. So there is a link with all these factors.
Okay, so let's stay a bit on causes of oral disease. And let's speak to you, Amanda. We've heard the notion around smoking. Smoking is always bad. It doesn't matter what system you're talking about. Smoking always causes, ill health. Sugar. Let's talk about children. Oftentimes we're told children who eat too many sweets and all sweet stuff end up with dental caries. Your comment on that?
That's right, yes. It is happening like that.
Right.
But obviously you can't keep sweets away from children.
Right.
You can't keep sugar away from children.
Right.
So the best is when you want to treat your children with sweets, the best is to do it after a meal, because then the saliva flow in the mouth is still high. And then the sugar will be washed away, to put it that way.
Right.
So that is the best way to do it, to treat a child with a sweet after they have eaten. Then you can look at carbohydrates, if you want to go into the food choices more. Obviously, you have to avoid the frequent eating of bad carbohydrates. Now, bad carbohydrates are the things, the sugar, the cookies, the jams, the chocolates, and the soft drinks. It's better to concentrate more on the good carbohydrates, like the seeds and nuts and grain foods, whole grain fruits and vegetables and fruits.
Okay. Do you want to perhaps take it further from there? I mean, talking about, I know that, the National Department of Health and National Department of Education have embarked on a school health program. What are the common problems there associated with oral disease in children?
Yes. Dr. Muta, what we found also is bottle feeding, where parents are using the bottle to feed their children.
Yeah.
Now, the liquids they put in these bottles, you'll find they are high in sugar.
Right.
And you'll find children sleeping with this bottle. That's what causes also a rampant caries.
Yes.
Now, what Department of Health is doing, we are part of Integrated School Health Program, and also we participate with the Department of Social Development Early Childhood Centers.
Yes.
Because if you have those are social determinants for the ill health, especially oral health.
Yeah.
So if you have early childhood centers, then your children, you leave them there. So the type of food they are going to get there, maybe it will be less in this bottle with high sugar concentration. And then if you go to schools, what we're doing in the public sector, we focus in school, we call them quintile 1 and 2, that's the poorest levels.
Right.
And then we deal with children from 6 to 12-year-olds,
right,
where we're doing brushing programs and fissure sealants. We can come to that later. Those
Correct.
are preventative programs which we are working with other departments.
Okay. Let's just take Joey on the line from Gauteng. Joey, welcome.
Hello there, how are you, sir?
We're good. How are you, Joey?
Okay. Sorry, I've just got one little question. I've been trying to look after my teeth. So what I've been doing all these years, I've been taking caltrate. I want to find out from the prof, am I actually helping myself? I'm just having expensive urine. I just want to find out. I'll listen on TV. Okay.
Oh, thank you. Brilliant question. He's taking caltrate or something. He wants.
Calcium.
Okay.
He wants to know whether it's a good idea or he's just making his urine expensive.
Let's just explain what causes caries, because that's what it's important.
Yeah.
It's sugar. And sugar, it's in different forms. If you go to a party, they give you a cake. If you've got sweets, whatever. Now, sugar alone doesn't cause caries. When you take sugar and put it on a tooth, and bacteria, or things that live in the mouth, let's just say bacteria, ferment or eats on that sugar, it produces acid. So acid dissolves the structure that forms the tooth or the bone in the mouth. And that's when the cavity, it starts to eat brick by brick, and then there is a hole. And that hole then goes down to the root of the tooth, and then we start to feel the pain. Now, when you are using these calcium, or we are using fluoride, we are reinforcing the building blocks of the tooth, and we strengthen it. So people can decide to take the calcium, but the best time to take them, it's when you are having the formation of the teeth. So we recommend it from early stages. In an adult, you are usually replacing the brick that has been taken away by these bacteria in the mouth.
So for somebody who's got a full set of teeth, no problem, no point in taking caltrate in order to prevent?
No, for an adult who is already at that level, there is no need, because the bone has been formed already. So we recommend it from early stages when the tooth is still being formed. In fact, we are saying as early as possible. You will remember that usually when mothers are pregnant, we say let them take calcium. Because the tooth, it's formed from 3 months when the fetus is conceived, even before birth. The tooth formation at that age, the teeth are already in the mouth when a child is born. It's only that they have not erupted into the mouth.
Correct. All right, let's take another caller. Claire from George. Claire, welcome.
Thank you. I had an experience that taught me a lot about a good way of dental hygiene, and that was that I had a problem in that I was developing what appeared to be an abscess. There was swelling and bleeding, and I thought, oh gosh, I must try and get rid of this, or I'm going to land up at the dentist and probably have a root canal. And I tried everything, and once in desperation I used a magnesium spray. It was incredible. I'd been trying for 3 months and it had been just slightly getting better and not. Within a few days, it had disappeared. And now I find that every time I use the same magnesium spray, if there's a mouth ulcer or something, it disappears. Of course, it doesn't taste very pleasant. And it occurred to me that quite an affordable type of mouthwash would be Epsom salts, because that's basically magnesium. And if you put a teaspoon of that in water, I think maybe that would be a good idea for a mouthwash.
All right. Okay. Claire, thank you so much for your contribution. We'll try and get the experts to comment. Let me give Amanda a chance. Do you want to perhaps just comment on what she said?
Yeah, she's correct. Bicarbonate of soda, if you can make a mouth rinse with bicarbonate of soda and use it as a mouth rinse.
Right. Okay. You know, I think the most important subject is how do we prevent oral health? That after a break. Please stay with us.
.5G technology, the Internet of Things and driverless cars are part of our reality.
For me, it's important that we get young girls and young women to also be innovators.
Data scientists solve problems using data, and that's required everywhere.
Then there's the Internet that's part of everything that we do.
It's an IoT broom, which basically means it's a connected broom. It's a broom connected to the Internet.
My favorite innovation has to be Waze.
On Network, we give you African technology and social media news. That's Network with me, Phumelele Zondi, every Saturday at 8:30 p.m.
How many times do people visit the dentist in a year?
In a year, I think it can just visit her 2 times. Yeah, because I think kanjalo imba safe because nayo ingikhuthazela ukuthi the more ngifika kwi-dentist is the more namazinyo wami aba healthier.
Ngiyaka u2 ngoba isikhathi esiningi amazinyo akusinto engihluphayo ngoba ngizama ukwanakekelwa.
Ngizama ngizwa amazinyo abuhlungu.
I visit maybe 3 times in a year, every after 4 months.
I usually visit once a year and I'll be going to check on my teeth, how they are, because I have too many teeth that are decayed.
How many times do people think they should visit the dentist in a year?
At least 2 to 3 times a year, I think unganceda ukuthi visit the dentist yakho because iyapaka ukungcola kuyapaka emazinyweni for a long time. Abanye abantu bayabhema benzane, so sometimes dentist yakho iyakwazi nokwa cleaner ngemishini yawo ethile.
Ingadepend ukuthi umuntu ubhizi kangakanani ukuthi uwezwe kanjani kodwa ngokwami ngathi angaya noma ka3 ngonyaka.
What I think is a person must visit a dentist like 2 times in a year.
Every month. I think every month because we don't know what the things we're eating could do to our teeth.
I think it should be twice a year.
Twice a year, every month? Well, we don't know. Let's hear from the experts. We have with us Dr. Mzimkhulu Mcuba, Acting Director, Oral Health at the National Department of Health, Prof. Simon Namatindani, Dean, School of Oral Health Sciences from West University, and of course Amanda Smith, who's an oral hygienist. Now, if anything else, this is probably the most important segment of this discussion to say, how do we prevent oral disease? Perhaps let's start with you. Start with covering basic concepts, Prof.
Well, oral diseases are preventable, except those that we say they are congenital, like I've mentioned, the cleft palate. But we are encouraging the community not to hide those kids because they were born with open palate and open lip, because that would be really unfortunate if we hide those kids. Services are available to assist them. But with regard to prevention, there are issues like how often you should be brushing your teeth, who to visit.
Perhaps let's stay on that, who to visit. We hear there's a dentist, there's a dental therapist, there's oral hygienist, there's orthodontist, there's etc., etc. We told that management of oral health is a multidisciplinary approach. Who's involved?
It's very interesting. In all African languages, there is no difference between dental therapies and dentists.
Yeah.
Kasipedi bari kingagaya meno, ngachivenda ndingagaya meno ngesizulu, ukikawa mazinyo, whatever. So African languages do not differentiate it. But as we are talking now, there are oral hygienists. Let's start with oral hygienists.
Yeah.
Their scope of practice is usually about prevention and education.
Right.
These are the most important health professionals that could really assist us in prevention.
Right.
The unfortunate in those slides, all of those patients were talking about dentists. They were not mentioning the oral hygienist. Probably they were not aware that oral hygienists exist.
Yeah.
So oral hygienists are there specifically for prevention. And with regard to school oral health programs, we'll be focusing more with oral hygienists.
Okay.
The second layer is the dental therapist. The dental therapists, they do everything that oral hygienists do. They are trained to do that, including patching of teeth, filling of them, but they are not going to an extent of replacing what we call crown and bridge, dentures, and also implant. Their training is limited. From that layer, we then have dentists. Dentists, they've got wide range of scope of practice that they do, but within dentists, we've got different specialists, the same as in medicine. We've got orthodontists, the one that make the teeth straight. We've got periodontists that looks at the disease of the gums. We then have oral pathologists who look at the disease in the mouth. We've got the MexFax, those that fix us when we have accident and all these sort of things. We do have community dentists or those who are really policy makers, and then we have prosthodontists.
Right.
These are the ones that makes implant and dentures.
Okay.
Now, these are the different layers, but I wouldn't encourage our patient to start with specialists.
Yes.
Let's start with the oral hygienist. The problem in South Africa is that we are focusing more on curative rather than prevention.
Amanda, oral hygienists, how do people access you? Where are the oral hygienists? People know where a dental clinic is and a dentist practice is, but where do they access oral hygienists?
Unfortunately, there is a scarcity of oral hygienists in the country, but you will find us in the public sector clinics.
Yeah.
There are oral hygienists. We are also working with a dentist in his practice.
Yeah.
And lately, an oral hygienist can start opening her own practice as well.
Okay. All right. So let's take Boy before we carry on. Boy from Gauteng. Boy, welcome. Boy, are you there? Okay, we'll come back to Boy. We seem to be having a slight challenge there. Let's come back to you, Dr. Mduma. You know, we're talking prevention. You did mention a few things about, you know, school health, integrated school health program and so on. Are there any specific areas that you focus on? I know you mentioned quintile 1 and 2, but in terms of prevention, what is your strategy to drive prevention at that level?
The prevention, mainly, we've got oral hygienists, even dentists that go to schools. Focus on education. When you give people information, they are at a better position to take best decision for themselves. Remember, health is about your own management. You manage your own health almost every day. So oral hygienists are extremely, extremely important in giving this information about how to brush, when to brush, what to eat. So prevention starts there with education. And then we go further by brushing. So as the National Department of Health, we set up a budget where we buy toothpaste and toothbrushes for these quintile 1s and 2s, so that they can brush at school. They've got meals, I think from 10 o'clock after meals, they brush. So what oral hygienists have taught them, so they implement it at school. Human beings are creatures of habits. So when you start brushing at that level with fluoridated toothpaste, not only you are removing the food, but also you are remineralizing the tooth. You are putting it in bed. The second part of it, with our prevention, especially in the public sector, there's something we call fissure sealant. It's a thin fluid. When caries start or decay start, it starts on top, especially the back teeth, because they are flat and they've got grooves. So you find the food is trapped between these grooves. So to prevent the starting of decay in these grooves, you put this slightly thin liquid called fissure sealant so that you close these grooves off. So this has been proven many, many, many years that it has helped to prevent dental decay.
So is that what you supply at schools as well? Is it?
Yes, we do. We do. But not all schools, because we're limited by budget. That's why we're doing quintile 1 and 2. That is the poorest of the poor, especially in rural areas. And then oral hygienists, mostly they are doing this. You do, by the way, find oral hygienists in the public sector. Amanda is right, they are scarce, but you do find them. But also we're limited by the budget. But that's the focal area for the Department of Health. As the minister will say, dental hygiene. So we try to prevent caries.
All right. I believe Boy is back on the line. Boy, are you there? Sikhona kunjani Boy?
Siyaphila. Ngimalela impisho yenu lana. Ngineproblem apha ngiyayithanda le nkqubo ngengayimamela nalast ku-Bonitas. So bendifuna ukwazi ukuthi amazinyo aqedayo ke awabolanga awubuhlungu asikavele aqede nje, and then ukuthi senidecide ukuthi ngiyolikhipha. So abangayini yakhoswa yini ukuthi abe njalo wona?
Okay. Thank you very much. So just to basically summarize what he said is, what causes teeth to become loose to a point where he now has to go visit a dentist to go get it extracted?
Well, the supporting structure of the tooth is the bone. Now, once caries has destroyed the crown, then it will be removed. But if the gum diseases have eaten the supporting structure of the teeth, then the tooth will become loose. It will be supported only by soft tissue. That is when you will remove it. But the other problem is when you have high blood pressure and you have diabetes, your teeth could also be loose. So you must go to checkup to check whether what is the cause. Do you have high blood pressure? Do you have diabetes? Those medical doctors and dentists will be able to check whether you've got those conditions. As I'm seated here, I cannot really give a definite problem as to what is the cause of it. But if
you're talking about the common
cause of it, it's because the gum disease has destroyed the whole bone and the tooth is loose.
All right. Okay. Time for another quick break. When we come back, we'll still continue a little bit on the subject of prevention and talk about treatment for oral disease. Please stay with us.
We are saying similarly here, in a process which is intended to be impartial and independent, he should similarly recuse himself.
One can build conspiracies, and the fewer facts you have, the more easy it is to build conspiracies. And I suggest to you that when suggesting that there is some conspiracy about the witnesses were called, you might not have been aware of the facts that I've outlined to you.
Zimbabwe belongs to all Zimbabweans from all the four corners of Zimbabwe.
What a time! 1:54.26, another meeting record. She made it look effortless. Once again, Caster Semenya, no pacemaker required.
Special assignment. Crime keeps the society in terror and pain. Why so?
If someone phones me, this phones me, tells me, okay, look, he needs a silver, and I get you all driving, I'll take it.
What pushes normal people to be so hard, heartless, and brutally kill one another?
The other side of it could be more for their own psychological need. It might be part of a sexual fantasy that they have. It could be about power and control.
After proper investigation is followed, the perpetrator gets arrested.
It's part of the massive process. And ultimately, they have penance. I think justice is served.
Emotional scars remain.
We would pay any price to get him back, and the sad reality is that it's gone.
Special assignment. We unravel the truth every Sunday at 21:30.
Dental therapist Kinda Modisha, practicing in Cosmos City north of Johannesburg, explains the functions of a dental therapist.
A dental therapist, the functions are mainly to do preventative measures on teeth, and also to restore those teeth if there's something wrong with them. For example, decayed teeth, we restore them, Preventative measures, we do things like a scaling and a polishing, where we clean the teeth. And then, but if the teeth is beyond a stage where they need to be taken out, we also do dental extractions.
What are the common conditions that a dental therapist see daily?
Well, in this clinic, the common dental problems that we get faced with, it's mainly children who've got decayed teeth. Their parents will come bring them and say, the front teeth are rotten and they want to be taken out. So in most cases, we try and prevent as much as possible to take them out before time. So we'll either try and restore them so that they can stay in the mouth up until the time is right for them to come out. So it's mainly those people who come with decayed teeth and those who come with problems with their gums, bleeding gums. Some will be those who come and say they've got a problem with their breath, tying it together with bleeding gums.
Modisha says taking care of one's teeth from an early age is vital.
People need to get used to having their routine dental checkups, which is twice every year. Go to your dental practitioner, whether it's an oral hygienist, a dental therapist, or a dentist, where you'll have your, what we call a scaling and a polishing, where they clean all your teeth and everything else, so that when you go and have that cleaning, they also do an examination, so it's easy to detect early if there's something wrong with your teeth, to prevent anything progressing.
Prevention is still the key there. And let's carry on with the subject of prevention and treatment. Our guest, Dr. Mzimkulu Mkuba, Acting Director, Oral Health, National Department of Health, Professor Simon Nemutendani, Dean of School of Oral Health Sciences at Wits University, and Amanda Smith, Oral Hygienist. Now, let's just take the question of prevention, and perhaps let's just put this to bed once. Are there official guidelines in terms of how many times one should visit a dental practitioner?
I wouldn't say it's a guideline. I think, as Ms. Modisha is saying, checkup is when you do not have any problem.
Right.
You just go and check up, and then the professional hygienist, dental therapist, and dentist look at your mouth and say, okay, you're still okay, or in future, this is what needs to happen. You go there when there is no pain. I agree with her, at least twice per annum, go just for a checkup. Okay. But sometimes you will go when there's a problem. But for children, what we have done in the National Department of Health, we've included in the Road to Health booklet. Now, every time the mother takes the child for immunization or a checkup, the nurse will check, I think it's page 20 in that book, and say, okay, because we've written at what stage a certain type of tooth erupts. So it will check that and say, okay, you can go now to a dentist or oral hygienist, you do 1, 2, 3. Mostly it's education and what type of food. So for children, a checkup might be more than twice per annum because it's linked to the visit to mother and child clinics. Okay. But for adults, if there's no pain or no problem, I would say really twice per annum might be the minimum to do that.
Amanda, let's quickly talk about brushing teeth and your comments on flossing, by the way. Many people would say, what type of toothbrush should I get? There's hard, there's soft, there's all of these. And toothpaste, there's such a wide variety of toothpaste. And the other question, I guess the most important, is how to brush the teeth.
Yeah, people can say that they are brushing twice or 3 times a day, but it depends on the method you use.
Right.
Because it is like washing your hands. You have to brush the inside of your teeth, also the outside of your teeth. You have to brush on top of your teeth the surfaces that you use to chew on. On the surfaces that you chew on, you can use a scrubbing motion. For the inside and the outside, you use a circular motion, and you use a soft toothbrush. And people tend to buy 2 big brushes for their mouths. They must actually use a small toothbrush.
And soft. So no need for a hard or medium and whatever. No. So why do they have these?
Well, there are a variety of products on the market. But if you are using a hard toothbrush or the bristle, they will remove the layer of the tooth. And people will say, I've got sensitive teeth, I cannot eat cold food or ice cream or whatever, because they've removed the whole layer. It's not about brushing very hard. It's where to brush and what to remove. Because
and how long should people brush?
Well, it could be 3 minutes if you are brushing correctly. But what do we mean correctly? The most important thing is brush or remove the bacteria and food on the surface of the tooth, on the side of it, and also on the tongue, because that is where we've got a lot of problems.
Flossing? Toothpicks?
Yeah, one could use toothpicks, but with one should be careful because sometimes I see people walking around with toothpicks, even in the public space, trying to remove the food, whatever. That is unhygienic. Let's just say that should not be done. But on a serious note, put a soft toothpick that will be able to remove. But if you've got tight teeth or you've got some teeth that are very spaced, you don't need to use the toothpick because there is nothing that you will be removing. A floss, if you can afford it, use it to remove the remnant of the food that we have eaten, which is between the teeth. That is the objective of removing food or sugar that bacteria can live on it.
We have a variety of toothpastes. What are the guidelines? Which one should you use?
Well, it's branding. Right. We've got different soaps, Omo, Salve, whatever.
Yeah.
The ingredient is what is important.
Yeah.
Because in a toothpaste, whatever toothpaste, whether we're talking about Colgate, Aquafresh, all these toothpaste, the most important thing, they've got something like abrasives that will be used to remove or clean the tooth. Other one's got fluoride. Yeah. The other one's got something that binds everything and the flavor. When you smell it, or the smell that you're having, the flavors of different things. But all of them check whether they've got fluoride, because fluoride is the most important ingredient that will make sure that tooth is strengthened. So the variety of toothpaste, but we know that the common toothpaste that are available, and also for what Z has mentioned, it's Colgate, because they have made partnership with the Department of Health to say they will supply it. But all toothpaste can be used.
Okay. So let's talk about, we're supposed to be talking a little bit on treatment now. But there are certain things that people do, before they get to see a dental practitioner. Perhaps let's start by asking the question, are there those telltale signs that say to you, this is now time for you to visit a dental practitioner, obviously outside the normal, regular visits?
By and large, the norm is the bleeding.
Right.
You'll start by bleeding, even before the caries start, because remember, as we have said, the caries is from the type of sugars or food you're eating, but what the food will do will just go between the tooth and the gum. And then when it does that, it causes the gum to swell a little bit, and then when you brush, you start bleeding. So that's the first sign of problems to come. So that's the time you can go and see your oral hygienist. I would say oral hygienist because those are the best people for me to start at, both in cost and the knowledge they have, because it's not only they are going to stop bleeding by scaling and polishing or cleaning your teeth, but they are going to give you education that this is how you brush, this is what you eat, this is what causes this bleeding. Yeah. So for me, that's the first telltale sign that I must go and see an oral health professional.
So some people would then choose to use all sorts of mouthwash or whatever they grab, to rinse their mouths instead of, visiting a practitioner. Your advice?
My advice with mouthwash, please don't put Disprin onto the tooth or into the gum. I know that people, they do it because of pain, because it makes the problem worse. It burns. Don't put spirits, petrol, and all those things. Don't do that because they make the matters worse. Yes, you can get your bicarbonate of soda, for an example, especially people who've got oral lesions, ulcers. You find there's an ulcer or a lesion in the mouth. Bicarbonate, it's an alkaline part. It subsidizes the pain. So you can mix the bicarbonate of soda with water and rinse. It can help. And also you can lose what you can buy on the chemist, like the mouth rinses and all that. But don't self-medicate with things that are making things worse. That's the advice I would give.
Okay. The one last point that I want you to just comment on is what we spoke about during the break, that sometimes going to a health professional helps because the health professional can pick up certain things that may not necessarily relate to oral health. Your comment?
One of the things I want to leave the listeners with, especially with the bigger surgeries for me, open heart surgeries and all that, it is so important that those specialists in those fields, they send those patients before they do those operations to oral hygienists. One of the linkages that it has been found, the infective endocarditis, or the inflammation of the heart valves, is linked to type of bacteria in the mouth, streptococcal viridans. So if you do cleaning before the operation, then you save the infection that might happen after that. And then for me, the second one, especially with these big operations, especially head and neck cancers, where you need radiation, do your dental first. Because if you do your radiation first, and then you find that there's a problem with dental, the radiation affects the jaw. And then if you do your treatment after the radiation, it affects the healing or whatever you do.
I'm afraid that's where we're going to have to leave it for today. Unfortunately, we've run out of time. It's been such a pleasure to have you around. Thank you so much for your time. Well, folks, that's how we come to the end of our show. And, of course, our guest, Dr. Mzumkulu Mkuba, Acting Director, Oral Health from the National Department of Health, Prof. Simon Nemitendani, Dean of School of Oral Health Sciences at Wits University, and Amanda Smith, Oral Hygienist. Thank you so much for staying with us. And we thank you for all the calls. And, of course, those that normally send us tweets, we thank you so much. We're back on your screens next week, same time. And until then, please do take care.
Temba Clinic is a government rehab center situated in Gauteng's West Rand. It's a home for young men struggling with drug and alcohol abuse. The center accommodates about 40 young males who are struggling with popular drugs such as nyaube, rock and mandrax. Addicts spend almost 40 weeks at the center going through various steps of therapy. Drug and substance addicts require a phase of detoxification at the start of rehabilitation journey.
We take them through the process whereby when they start in day one, the first 10 days of them, we do medication, whereby they're getting medication from the nursing department. So we detoxing them for 10 days. And after 10 days, there's this whereby we start with our individual therapy, because now they've been detoxed and they can be able to say whatever they want to say with us.
Once drug addicts take a decision to go through a rehabilitation process, community and parental involvement plays an integral part to prevent future relapse. Education for family members is another important aspect of the rehab programming. The Itemba Rehabilitation Center is dominated by addicts from economically disadvantaged communities, which makes the road to recovery more challenging.
So we sometimes face issues when it comes to parents being more supportive in terms of being able to come for visits. And I think on the broader scale, when they leave here, the chances of relapsing becomes higher if the parents are not involved in the process while they're still here. And not being able to understand what addiction is and the support that they're going to need from here on out. I think it's very important that families need to be involved from the onset. They also need to be educated about addiction, because I think when the service users leave here and they go back to the communities, they're still labeled bonyaupes, or the words, the derogatory terms that they use.
Being drug-free for over 3 years now, Xolani embraces the new opportunity presented to him.
Before